We're going to talk now again about developing indicators for measuring the impact and success of your allied health assistant model of care. In particular, we're going to talk about what influences impact. Our learning outcomes remain the same as last session. Recall this image that we went through in the last session. The key point from this is that there are multiple different areas, mechanisms, contexts that influence client outcomes and influence how well your allied health assistant can deliver care to the client and therefore influence client outcomes. We're going to talk a lot about the organisational and some of the allied health professional factors that influence allied health assistant capacity to deliver the type of care and the intensity of care that brings about positive client outcomes. In our work that looked at those 30 teams across the UK that worked in social care, disability and health settings, we measured a number of factors on a tool called the Workforce Dynamics Questionnaire, which looked specifically at teams that are interprofessional and multidisciplinary that work with large and different configurations of allied health professionals and allied health assistants. The Workforce Dynamics Questionnaire looked at a range of questions that identified how satisfied staff were, whether they were intending to leave or remain in the organisation, and the varying factors that might influence that. So from that information and from memory, we had over 250 allied health professionals and assistants respond to that questionnaire. We were able to look at how team dynamics or workforce dynamics came together to then influence patient outcomes. Here are some findings from that research. There's a number of different points to make in the next few slides. I'm just going to read one of them. From this slide, what we found was that a large team size is associated with improvements in patient outcomes. Part of this was because in larger teams, they seem to have a greater diversity of allied health professionals within the team. Please read these two and digest that information before I click to the next slide. We also found that having high team working scores was associated with high staff satisfaction and a lower intention to leave. Higher staff integration scores were also associated with satisfaction and a lower intention to leave. Part of this was attributable to weekly team meetings as opposed to less frequent meetings, and that was associated with greater staff satisfaction. We also know that teams in which staff perceive they deliver a high quality of care also have high staff satisfaction and low intention to leave. Note in these 4 points, one of the key indicators here is staff retention. Consider how staff retention or lack of influences the outcomes of care for your clients and the success of your business. Consider if these things are in place and how well you're doing against some of these measures in your team at the moment and how that might look if you introduce allied health assistants into your team. We also know that better training and development opportunities for any type of staff is associated with greater staff satisfaction and also a lower intention to leave the employer. The key point to make here though, and I think we've mentioned it before in terms of the need for role clarity and how role clarity and good delegation practice helps staff to be more satisfied in their role. But sometimes we find in community settings, and in particular those who are working with older people, the risk of descaling is an important component of job satisfaction and intention to leave. We've looked at a number of mechanisms to assist with that, in particular ensuring that allied health professionals and allied health assistants both work to their full scope of practice. But secondly, it links in here. offering good training and development opportunities as well. These last 2 points are really tricky, but they also link in with the idea of making sure that you have career pathways for your allied health professionals and assistants, and that you have a good scope of practice around both, and that both allied health assistants and allied health professionals can work to their full scope of practice. So within that, both AHPs and assistants can be more autonomous in how they undertake their care. This is important because we know that the more autonomous staff are, the less likely they are to report an intention to leave. Now, because of this, and in particular in teams where delegation didn't happen well, or where there was no room to move, or where de-skilling was apparent, we found that support workers or assistants were more likely to report an intention to leave their employer, and this was directly linked to being less autonomous and the risk of de-skilling, both of which have a lot to do with the success of delegation. And I know we've covered that in another module. To wrap up these few slides, some other organisation and team level impacts on allied health assistants and the rest of the team are that higher team working scores are also associated with a lower cost of service delivery. I'm not going to go into this, and you can read it in some of our research, but this indicates that teams that are satisfied, happy, working together, meet frequently, have good management and a good team leader, provide efficient services. And if we consider our driver for care as being that of improving client outcomes whilst keeping the costs of care to the client low, this is a key factor. Higher staff integration scores are also associated with lower costs of service delivery. And finally, better access to technology and equipment was also associated with a reduced length of stay, where that was an outcome of interest for some of those services. Finally, we know that inconsistent or discretionary delegation from allied health professionals to AHAs is associated with underutilisation of assistant staff. We have demonstrated time and time again through this series that the key to ensuring maximum impact of the allied health assistant workforce is the need to move away from a model of discretionary delegation towards a codified, systematic approach to delegation and defining role expectations based on competencies. So let's summarise all the different outcomes and impacts that we've seen that allied health assistants can influence. In multidisciplinary teams, we know that the factors associated with improved client outcomes are greater time spent with the assistant, a greater proportion of care provided by an assistant, and the type of care that's delivered by the assistant. In multidisciplinary teams that utilise allied health assistants, here are some factors that are also associated with job satisfaction. How does this look in your organisation or team? How will this change when and if you introduce an allied health assistant? And finally, in multidisciplinary teams with allied health assistants, these are factors that are associated with an intention to leave. Consider again the cost of staff turnover in your organisation and the cost of that to improving your client outcomes or disrupting the continuity of care to your clients. Here are some of the factors that we know from our research in allied health teams that can influence intention to leave. In our next session, we're going to talk exactly about how to develop indicators with all of this information.